Hello, I'm Dr. Emre Karakoc. I'm an internal medicine consultant in Treetop Hospital. Today I will share some information about diabetes mellitus with you. Diabetes is a chronic metabolic disease that which your body does not produce enough insulin and your glucose get high, so it can cause some metabolic and on the long term some organ problems. There are different types of diabetes, mostly known as type 1 and type 2, and there's also a gestational diabetes mellitus. If not treated properly, it can cause organ damage and in long term lots of suffering, I think. When your blood glucose get down to a certain level, like 70 milligram per deciliter, and if you have symptoms, we call it a hypoglycemia. At this level, you need to take some actions because it can be extremely dangerous. Actually, exercise and diet is the most important part of the diabetic management. I think it's more important than any other medicines. So you have to do exercise regularly. When we say exercise, we don't mean that rigorous exercise, but at least walking 40 minutes per day is enough for most of the patients. Actually, nutrition, it's not so simple. We call it actually medical nutritional therapy for diabetic patients. So there are different aspects of this issue. We have to arrange how much calorie the patient needs and how often does the patient need to get fed. So we need to the patient needs to get support from a professional dietitian for a proper diabetic diet management. Diabetes screening is very important because if we diagnose diabetic patient early, we can manage it better. The better you get managed, the less complication you have. Even before the diabetes diagnosis, even before the patient has this diagnosis, it will be better to manage them. I mean, if you have someone else diabetic in your family, we assume that you are pre-diabetic, so the action should be taken at this stage. So we can prevent the diabetes before you have diabetic diagnosis. Thank you for listening.